Mm. I came for the crack.
What's up, guys? It's Dr. Neville, aka Dr. Ginger Ninja. And today we have a special guest, Kristen, with us today.
Hey.
Today is her very first chiropractic adjustment. So we're super excited about that, but she has quite the extensive history. She's a breast cancer survivor.
Yes.
That's awesome, congratulations.
Thank you.
But she has such the history of different medical conditions and injuries through sports and her different athletic endeavors. So we're gonna hear all about it today.
Awesome.
Okay, so let's start with the breast cancer. When were you first diagnosed with breast cancer?
I was diagnosed in January of 2024. I found a lump in my breast, had a mammogram, then a diagnostic mammogram, then an MRI. We did a biopsy, it came back as cancer. So I had a double mastectomy and 5 months of chemotherapy.
Now, did that create any other issues at all? Any shoulder issues, neck issues, musculoskeletally wise?
No, it did not.
Okay.
I was lucky with that.
That's good. That's
Yeah.
very good. I do see a lot of patients that, especially after a cosmetic breast surgery, after mastectomy, a lot of times they get very rounded. They end up having rotator cuff issues or neck issues. So that's really good. But you do have a history of neck issues as well. You said from a car accident?
I do. I was in a car accident in 2019 and got a pinched nerve in my neck. I believe it was C7 that was compressing it, and I ended up getting 2 epidurals.
Neck pain, was that creating radiating pain, radiculopathy?
Yeah, it radiated down my arm and into my middle finger.
Okay, so you also mentioned you're a runner, and what injuries have you had from running and sports?
Well, I played college basketball and I blew my left knee out my sophomore year of college, and I had a complete ACL replacement and meniscus.
Okay.
Blew it out again doing box jumps at the gym.
So do you had surgery on that as well for a
The
second time?
Yeah, it was a complete tear.
ACL reconstruction.
Meniscus twice.
And meniscus twice. So knee, neck, low back issues?
Yeah.
Is that what kind of bringing you in today?
That's what's bringing me in today.
Okay, low back. So tell me about the low back. What's going on there?
It's been since my cancer treatment. Laying down and sitting, I get sharp shooting pains in my lower back.
Does it just stay in the low back, or does it travel down the legs?
No, in my back.
Just in your back?
Yep.
Okay. Coughing, sneezing, does that make it worse at all?
No.
Okay, that's good.
Worse morning and night.
Okay.
And if I'm driving.
All these different injuries between your knee, your neck, your back. How have you never been to a chiropractor yet?
Well, I'm a busy single mom of 3 girls, so they take up most of my time, and I've done a lot of PT.
What did they do in physical therapy?
So we did a lot of cupping, a lot of stretching, and I was obsessed with spinal decompression. It felt so good.
Oh yeah, especially for disc herniations, spinal decompression is one of the best treatments you can do. Okay, so since today is your very first chiropractic adjustment, how are you feeling? Are you nervous? What's going on?
I'm a little excited, but I am a little nervous.
I'm gonna do some orthopedic tests on you. I'm gonna do some neurological tests on you and bend you different directions, see what feels good, see if there's anything that recreates the pain. We're gonna review any imaging that you have.
Okay.
If we need to take new imaging, we will, but we'll review everything. And then when we adjust you and any therapies we do on you, I'll explain them before we go, okay?
Sounds great.
So I'm gonna start you off looking straight ahead. I'm gonna compress the top of your head without messing your hair up, pushing that down. Does that recreate any pain in your neck, in your back, anything down the arms?
No.
Good. Okay, I'm gonna rotate to the right and extend your head back this way. How's that there?
Okay.
Just your low back down here? Nothing in the neck?
Nope.
Good. How's that there?
Good.
Good. Awesome. That's a good sign that that disc is really doing well, because that's kind of compressing those nerves on each side. So the fact that that doesn't recreate any neck pain, doesn't radiate down, is a really good sign.
Awesome.
If I just lift up like that, still feel good with that?
That feels awesome.
Yeah, just kind of recreating that decompression that the spinal decompression machine does. Now I'm gonna bend you to the left here as I bend here and then rotate back. Any pain with that?
No.
Good. Any pain recreated with that?
No.
Good. So this is a pinwheel, and what we're going to do is we're going to be checking your sharp sensation one side versus another, and it's checking dermatomes, which are areas of skin that are innervated by a single nerve. So for instance, we were talking about the hands. This is C6 nerve. This is C7, this is C8. So if there's a difference from one side to another, that tells me to look at that specific level, what level in the neck. Same thing with the legs. I'm going to be checking the legs and figure out if there is a difference one side versus another. And that tells me kind of which level to look back to in the spine. Here versus here. Feel the same? Good. How about there versus there? Good. How about C6 versus that side? Good. And this is that C7 dermatome that was reduced previously.
That's good.
Does it feel equal? Good. And then this is C8 dermatome. All equal there? Good. Okay, check in the lower extremity dermatomes. Here versus here. Feel the same? Good. How about there versus there?
Same.
And out here versus out here. So we're also going to be checking your reflexes as well, and that's going to tell us if there's any issues with the spine as well. Okay. We're going to do a straight leg raise now.
Okay.
Bringing this leg straight up. That doesn't recreate any pain at all?
I feel it in my back.
You feel it in your back? Okay. Does this make it worse as we bring that back there?
No.
No. Now, is that pain more than just stretching, or does it kind of recreate the pain?
No, it recreates the pain.
Okay. Just purely stretching?
Yep.
Okay. So normally between 30 and 70 degrees, that recreates some pain there?
Yeah, it popped.
Okay. So if that recreates pain between 30 and 70 degrees, that's positive for something pushing on the nerve. As we raise this leg, we're putting stress on that sciatic nerve. So if that recreates some of the back pain, that kind of tells me that, yes, something's pushing right on that nerve as we're stretching on that nerve and irritating it.
Okay.
So that kind of tells me, even though you're not having any radiating nerve pain down the leg, your dermatomes are the same, your reflexes are pretty much equal and symmetrical bilaterally. That still tells me that there is a little bit of irritation in there of that nerve, but you're not you just said you don't have any radiating pain, right? Okay. So let's check this hip as well. Bringing this hip up as I rotate like that. Any pain this way or this way? Good. As I bring that across, just purely a stretch. Good. If I push down on your hip here, no problems there. Rotate there and there. No problems there. Good. Pushing your hip down there.
No pain.
Good. Okay. And then this was the knee that, so I'm going to test those there as I push there. Any pain with that? Good. If I pull like that.
No.
Any pain there? Good. Straighten out knee, pushing that way.
No pain.
No problems there. Pushing out that way.
No pain.
Good. Does your knee bother you at all, or has it been pretty sound?
I wear a brace on it if I'm running more than 3 or 4 miles.
Okay. If you don't wear the brace, does that create pain?
Yeah.
Where do you get the pain in the knee when you get it?
Like underneath my kneecap to where it...
Kind of under here?
Yeah.
Okay. This spot here is the patellar tendon. So your quadricep muscles come down on your kneecap, and then there's a tendon that goes from the kneecap to the tibia here. So as that quadricep extends, that pulls on that tendon to extend your leg. So often called runner's knee. Very, very common where you create a tendinosis of that patellar tendon. Any pain with that?
When you bent it, I can feel it in my back.
Okay, just in the back when you bend it? All right, as I twist, ooh, felt that pop. Any pain with that?
No.
Good. As I compress and twist?
No.
No pain in the knee? Good. That's a test for the meniscus. So that seems to be good. But as we bend this, you feel some low back pain?
Yeah.
Okay.
Ooh, a lot.
A lot there? Okay. How about as I bend this one here?
Yeah.
Same thing? Okay. If we bend this knee and we lift up like this.
Ooh, yeah.
Same thing? So that's a test for the SI joint. So there might be some SI joint compression through there as well. You're saying the pain, is that where you're having the low back pain normally, or do you having it more kind of across through here?
Across through there.
Across through there? Okay. So your back feels pretty compressed through here. So what I'm gonna do is I'm gonna start you off with a little bit of some gentle traction to kind of decompress your low back. And then we'll do a little vibrational massage to loosen it up, and then we'll get this all adjusted for you, okay?
Sounds great.
gonna go down like that. Any pain with that?
No.
Okay, so that's just gonna traction you out there. I'm gonna push up while that goes down. You okay? All right, so that's just going to decompress the spine. So where that low back gets so compressed through the disc there, this is just a gentle way to traction it. Kristen, tell me about the Susan G. Komen work that you do.
So in 2025, I was nominated to be a Ford Warrior in Pink right after I had beaten my triple negative breast cancer. After that, I was invited to be on the executive leadership committee. I traveled to Washington, D.C. and advocated for breast cancer legislation with our representatives. I was a top fundraiser the past 2 years, and they asked me if I would be the event chair for the 2027 More Than Pink Walk in West Palm Beach.
Wow.
So I'm super excited.
Thank you for all the work you do, and that is fantastic. I'm sure that with that you are saving countless lives.
Yes, that feels so good. Oh my God.
Well, the pressure that I'm putting in is creating more traction to it. All right, let's do a little vibrational massage through there. Loosen. So what we're doing is we're doing a little bit of percussive massage with the Hypervolt, and the Hypervolt actually just loosens up the muscles. It brings blood flow to the area, but I often do a little vibrational massage before an adjustment just so that the muscles aren't guarding as much. Just loosens up before the adjustment. I find that people hold their adjustment much better if the muscles aren't quite so tight around it.
Kristen, how did you find Dr. Neville?
So I saw one of his Instagram videos that said he had the best crack in town.
Oh, I think I know which one you're talking about.
Let me in. I need that crack.
Dr. Neville's booked.
What about that 5 o'clock free crack giveaway? Yeah, baby. Oh, Shazam. Oh, come on, baby.
So you came for the crack.
I came for the crack.
I'm gonna have you lay on your side. I'm gonna set you up, kind of make sure that it doesn't recreate any pain before we adjust you.
Okay.
Make sure everything, if anything you feel any pain or any discomfort or anything, you give me feedback as we go. All right, in that position, any pain with that?
Mm-mm.
Okay, as I rotate you there, any pain there? Pain with that?
Yeah.
Okay. Let's bring this leg up here in that position as I start to rotate you. More pain or?
Yeah.
Pain? Okay. So take a nice deep breath in, blow all your breath out. I'm going to follow that breath down just to make sure it doesn't recreate any pain. Still good at the end of your breath there?
Yeah.
Good. So we'll give a little adjustment at the end of your breath going that way, okay? You might hear a little pop with it. All that pop is gas releasing out of the joint. Okay. So that's a normal, same as popping your knuckles, no different. Okay.
Oh.
You all right?
It sounded like the noise. Oh, right there.
Right there?
Uh-huh.
Pain right in there?
Yep.
Okay. So we're going to adjust that a little bit differently, because if pain is recreated when we twist you, that's kind of your body's warning sign that we don't want to thrust through there. Okay. So I'm going to have you go back face down here. When you're so locked up like that, or if there's a little pressure on the nerve, that a certain position will recreate it. Okay. So I don't want to thrust through a position that recreates the pain, because that can actually piss the nerve off. Okay. So what we'll do is I'm going to do a Thompson drop table on you. So this little piece of the table is going to pop up. It's going to drop out from underneath there. Okay. And blow it out. Another one. Blow it out. Another one. Blow it out. One more there. Blow it out. Good. I'm also going to use an ArthroStim on your back too. So it's a little tool that seems like a little mini jackhammer that's going to produce some thrust through there to get some mobility. Okay. So we're gonna do a thoracic anterior adjustment on you. We're gonna give you a hug, and we're gonna put my fist underneath your mid back. I find that patients that have had breast reconstruction, that sometimes the risk of a ruptured implant is too high if you're going face down.
Okay.
So this is typically anybody who's had a breast reconstruction, we adjust them more anterior.
Okay.
Take a nice deep breath in, blow it out, let it relax there. Good. A little squeeze. Good. Another one. Nice deep breath in. Blow it out with the shoulders. Just relax there. Good. There we go. One more. Deep breath in. Blow it out. All right. Bring this across. Take a nice deep breath in. Blow it out. Let the shoulder relax there. Good. Good. Okay, we're going to check the feet and knees here as well. Make sure everything as a runner is moving properly. All right, let that foot relax. We're going to give that a little pull here. Let that foot relax.
Mm.
All right, as I hyperflex there, you okay with that?
Yep.
Good. As I go a little deeper with that, still good?
Mm-hmm.
Good. C6, 7.
Mm-hmm.
I'm very pleased. I mean, for having a disc herniation in there, those joints are moving well. So if you're not having any symptoms and you have a history of the disc herniation in there, and, and most importantly, it's moving well, there's really no need to adjust it. So sometimes on YouTube, everybody wants to see the big neck pop, the big crack, the big cervical diversified rotary adjustment, but sometimes that's contraindicated. Or sometimes it's just not, when the joints are moving as they should, that it's not needed. So case in point, her C6, 7 is moving really well there. She does have some knots through here, which we're gonna work on, but that doesn't need a big pop and crack in there to restore that movement because the joints are already moving properly. But that's the key, is that you gotta go to the right chiropractor to make sure that in diagnose, is it moving, is it not? Then if it is not moving properly, then that's when a adjustment may be needed. But that's the key, is determining whether an adjustment is needed or not. So you're also a realtor, right? Because I saw you on Instagram as well, because I love your videos. I love your realtor videos and all the ones you do for breast cancer awareness as well.
Thank you.
They're fantastic.
Thanks.
We'll just do look up to the ceiling and then down to your chest. Good. Back up and down. So we're doing a little myofascial release to try to loosen that up. Back up and down. Good. And then put your hands on your hips. Good. Maybe you push your elbow straight back against me. Good. Same thing here. Good. Okay. How's that feel?
That's good.
Feel all right? Okay. I want to have you stand up, kind of move your back around there. It still may be a little bit sore there, but how's that? Any looser there?
Yeah.
So that was your very first chiropractic adjustment.
Yeah.
What'd you think?
Yeah, I feel good. I didn't realize how bad my back hurt, I think, until we were working on it. I'm such a busy mom, and I push through everything, and I run through everything.
Yeah.
So
yeah,
was
your
surprised.
back, obviously your back was very locked up. There's only one side we could do a manual adjustment on. The other side, your body was kind of telling us that it doesn't want to twist that way. So The biggest thing that I talk to people all the time about is listening to their body. And that's whether that's in a chiropractic adjustment, whether you're running, whether you're stretching. The big thing is listen to your body. So your body was telling us that that's kind of recreating pain there.
Yeah.
So that's why we took some alternative approaches. We did the drop adjustment, we used the ArthroStim on there. So the big thing is listening to your body. I think as we start restoring this mobility to the joints, that's going to in turn create a neurological effect where all the muscles start loosening up and you're going to feel better very quickly here.
I was surprised how good it felt when you were working on my feet.
Yeah. So a lot of people will have surgery, but then they ignore the joints around there. And especially runners, I mean, you're pounding on your feet with every step. Then you have a surgery, but their feet never get adjusted. You got to adjust the hips, you got to adjust the feet, and make sure those joints are moving properly so that the whole kinetic chain can function how it's designed to. So if viewers want to get involved and support the Susan G. Komen Foundation, what's the best way for them to get involved?
So go to Susan G. Komen, find your local walk or race, and join or donate.
Perfect. So if you're watching this video and you want to help Kristen and any other breast cancer warriors, we're putting the link in the description below. And if you like this video, check out this other video from us or this playlist down here. And as always, punch that like button, subscribe, and we'll see you in that next video.